A growing body of research suggests about 1 in 8 women will develop some form of maternal mental health issue within the first year after giving birth. Researchers also found postpartum depression often begins during pregnancy, and it can develop anytime within the year following the birth. Here with more are my guests, Dr. Sean Donishmond, OBGYN at Sharp Mary Birch Hospital for Women and Newborns, and Dr. Christopher Moresh, a psychiatrist with Sharp Mesa Vista Hospital. Welcome.
Thank you for having us.
Thank you.
Dr. Donishmond, you work with women who have high-risk pregnancies. Have you seen postpartum depression start during pregnancy, and what are some of the symptoms of postpartum depression?
Well, we see some signs of depression. I mean, there are patients that may have certain risk factors, a patient who's had a history of depression, so certainly we're going to talk about those symptoms throughout the pregnancy. But if the patient has never had those risk factors, such as a family history of a depression herself, then a lot of times patients start talking about stressors in their lives. They come in, they may be crying a little bit more. I'm a little bit more tearful. You know, my partner is not as engaged. I'm having some issues with work. So it starts that way, and that's the first sign that you have to pay attention to this patient after delivery as well. So we start talking about that. Hey, this is something that we need to look more into detail once you deliver, because you may develop postpartum depression.
And Dr. Moresh, what's the difference between postpartum depression and, let's say, other types of maternal mental health issues?
Well, postpartum depression is sort of limited to the time before and during and especially after pregnancy. Maternal mental health is sort of an umbrella term. It's sort of an integrative approach to women's health in general. So it's a component of women's mental health, because women suffer the same mental illnesses as men do, sometimes more often than men do: depression, anxiety, and other disorders. So what we're focusing on here, of course, is postpartum depression, and that is the disorder after a mom gives birth. And it's a very characteristic disease, and it is just that, a brain disease, as a result of depression after delivery.
How do you, Dr. Donishmond, how do you screen women for postpartum depression? Do you screen them during their pregnancy, after their pregnancy?
So if they have the risk factors, very important to talk about it. If they don't have the risk factors, postnatally, we give them a screening test. So it's basically a questionnaire. They answer 10 questions themselves, and if they score high, more than 10, we want to refer those patients out to the specialist, or see them again within the next week or two. So every woman who comes into our office, and really this should be done nationwide, gets a postnatal screen immediately after delivery and 6 weeks afterwards.
And let's say they've done this screen, Dr. Moresh, how can you tell if this is just postpartum depression that's moving on to something like postpartum psychosis, or there's some other mental illness going on that might have been triggered by pregnancy?
Well, again, oftentimes we'll start to see some worrisome signs while mom is still pregnant. And again, this is the awareness component. I think it's just like the awareness of screening moms for diabetes and thyroid disease from years ago. Now we're looking at mental health components. Baby blues are something different. Every mom after giving birth has baby blues. That's just coming off of all that estrogen and hormones. But postpartum depression often starts 2 or 4 weeks after delivery, perhaps as long as 12 months after delivery. And it's a very characteristic disorder. It's difficulty attaching to the baby, having fear of the baby or fear that she might harm the baby. It's intrusive thoughts. And often it's times where moms aren't going to say anything because they're afraid to.
That's what I wanted to ask about. Women, it does seem, might be reluctant. How come they're reluctant? What are they afraid of?
Well, I think that in people in general, there's a stigma still with mental illness. They fear that they're going to be called bad moms or that they're not good enough to be a mom, and they already get advice from family members about how to be the best mom possible. So it's pretty intimidating. So when we talk to patients, we try and take the blame out of the conversation and say it's not a mom problem, it's a brain problem.
It's supposed to be a happy moment.
That's right.
So when they feel that way, they feel a little bit odd, and women are very proud.
And it's a hormone issue again, right? The hormones spike and drop, as you mentioned.
So genetic predisposition, hormonal, I mean, hormones increase by 100-fold, and then all of a sudden after delivery they decrease. So if you have a genetic predisposition to it, if there are other stresses in your life, then certainly you can end up with a disease.
You know, what type of treatment options are there for women with postpartum depression?
It's usually medication, psychotherapy, support groups. So it's a combination of things. We're not 100% sure if, it may take a certain time for a medication to be adjusted or several medications to be adjusted to take effect, but support groups certainly help.
Absolutely.
Having a supportive family partner really helps.
In a nutshell, what should new moms, family, friends do if they suspect that a woman really is suffering with postpartum depression?
Realize that this is part of life. You know, all of us are working very hard to survive in this world. This is something that you need to speak up about. This is not, it has nothing to do with you. It's a mental issue. It's something that needs to be addressed with caretakers, with partners, with family members, so we can address it, because this has long-term complications. It has implications with you bonding with your child. It has issues with bonding with your partner and marital discord. So it's got a lot of negative implications if it's not addressed quickly.
Well, we're out of time, so we have to end it there. Dr. Donishman and Dr. Moresh, thank you very much.
Thank you for having us.